Perfect. Great. So hello, my name is Grace Power. I'm a medical student at Dalhousie University in Halifax, Nova Scotia, Canada. My preceptor for this project was Dr. Satvinder Gotra. And the title of my presentation is Formula Feeding Significantly Increases Risk of Iron Deficiency in Very Preterm Infants During the First 4 to 6 Months of Life. So a little bit of background. We know that preterm infants are at increased risk for developing iron deficiency. And this is really important because iron deficiency in infancy, even if it's corrected, is associated with developmental and behavioral problems later on in life. So that's well documented. And then breastfed preterm infants in particular are considered at increased risk of iron deficiency because breast milk has a much lower iron content compared with standard infant formula. So iron supplementation is considered standard of care for breastfed preterm infants across the board. But recommendations for iron supplementation for formula-fed preterm infants aren't very clear. They vary across different professional bodies, and there's very little research right now looking at how feeding type relates to iron deficiency in preterm infants, and specifically in the very preterm infants that we looked at in this study. So for example, the Canadian Pediatric Society guidelines from 2019 recommend that breastfed preterm infants should receive iron supplementation of around 2 to 3 milligrams per kilogram per day to meet their needs. But formula-fed infants are said to sort of receive 2 to 3 milligrams per kilogram per day of iron from formula, and so the Canadian Pediatric Society says they don't need iron supplementation. The guideline lacks strong scientific evidence, so it's based on kind of professional opinion and what clinicians say works. And then the American Academy of Pediatrics doesn't provide any recommendations either way because they say there's not really enough evidence either way for iron supplementation in these formula-fed preterm infants. So our objective of this study was to look at how the type of feeding influences the iron status of very preterm infants at 4 to 6 months of corrected age. So we looked at all very preterm infants, so that means any infant born less than 31 weeks gestation who was born in Nova Scotia between 2005 and 2018. So all infants in Nova Scotia are followed, when they're preterm, are followed by the perinatal follow-up program, which goes through the IWK Health Center in Halifax. So that's how we know we sort of gathered all the infants in this category. And then we obtained the information through that provincial database, as well as from patient charts in the IWK. So our predictor variables were feeding type, so were they breastfed or were they formula-fed, and how much iron they received each day from formula and supplements combined. And then our outcome was the presence of iron deficiency at 4 to 6 months from the mother's due date, so corrected age. And then results, that's really tiny, sorry. We had 392 infants born between 23 and 30 weeks gestational age. 285, so around 3/4, were formula fed with iron-rich formula. And then 107, so around 1/4, were either exclusively or partially breastfed. And what we found was that the formula-fed infants from iron from formula and supplements together actually received on average 2.59 milligrams per kilogram per day of iron, as opposed to the breastfed infants who only received 2.02. So the formula-fed infants on average received more iron than the breastfed infants, and that was a statistically significant result. And then contrasting that with the number of formula-fed infants who actually had iron deficiency. So 36.8% of our formula-fed infants were iron deficient, as opposed to 20.6% of the breastfed infants, and that was also a statistically significant result. So essentially, formula-fed infants were receiving more iron each day, but were actually more iron deficient and had a higher prevalence of iron deficiency on average. And kind of just to look at the Canadian Pediatric Society guidelines, which say, okay, formula-fed infants are gonna receive 2 to 3 milligrams per kilogram per day based on formula alone. We actually found that, oh dear, this should have percentages, sorry. Around 80% of our formula-fed infants actually were receiving less than 2 milligrams per kilogram per day. And then around 20% were receiving what was assumed they were receiving from formula, so that's at least 2 milligrams per kilogram per day. That really doesn't kind of support this assumption of the guidelines that says, you know, they're receiving enough iron already. And then as kind of a secondary objective to this study, we looked at risk factors for iron deficiency in the formula-fed very preterm infants specifically. So those were found to be, on regression analysis, lower birth weight, so birth weight less than 1,100 grams, younger gestational age, so gestational age less than 28 weeks, and need for blood transfusions during their hospital stay. So what can we conclude? So we can conclude that most, so 80% of formula-fed very preterm infants actually failed to receive at least at least 2 milligrams per kilogram per day from formula alone, which contradicts the supposition of the CPS guidelines. And then that despite higher iron intake overall, iron deficiency is more prevalent in formula-fed infants than in breastfed infants. And so this suggests a need to revisit the recommendations on iron supplementation in formula-fed very preterm infants. And so clinically, what does this mean? It means that physicians should consider individual risk for iron deficiency when deciding whether and how to supplement these infants, as opposed to just blindly following guidelines, because we know that different infants are going to respond differently to iron supplementation, and that iron deficiency is a significant problem in these infants. So next steps, so we hypothesize, and this is kind of based on kind of past work and past hypotheses, that iron from formula is not actually absorbed as well as iron from breast milk. So there could be a lot of different reasons for this. Breast milk contains different hormones, lactoferrin being one of them, but there's many more that may aid in iron absorption. So there's just a different chemical composition of breast milk that might help with iron absorption, despite there being less iron overall. But we need more research to corroborate these findings. We need, randomized control trials, and we also need to study the bioavailability of iron from formula and how that works in these infants. So acknowledgements, funding, just a RIM summer studentship from Dalhousie University, and then I'd also like to acknowledge all of my co-authors that helped with this project. Thank you, and happy to take questions at the end.